providers, care plan, and orders. Knock, knock, knock. May I come in?
Yes.
I'm maintaining standard precautions. I'm going to close the door for patient privacy. I'm going to close the curtain for a little more privacy. I'm going to sanitize my hands, and I'm going to go ahead and grab my gloves. Hi, my name is Brittany DeVries. I'm a student nurse here at Nevada State College. May I go ahead and see your wristband, and if you could please state your name and your date of birth.
Yes. My name is Henry Jones.
And your birth date?
Birth date is September 23rd, 1972.
And do you have any allergies?
I do not.
Okay. May I go ahead and pull up a seat?
Yeah.
So today we'll be inserting a nasogastric tube. Are you familiar with this?
I am not.
Okay, so basically what I'm going to do is I'm going to insert a tube up your nose, down the back of your throat, and into your stomach. This is going to help provide you the nutrition that you need since you can't have anything by mouth.
Okay.
Do you have any questions?
Is this gonna hurt?
It will feel a little uncomfortable, but as I'm advancing the tube down your nose and the back of your throat, if it becomes too unbearable, just go ahead and give me a signal, like touch the top of my hand, and we'll go ahead and stop.
Okay.
Okay? Okay. Before we begin, have you had any recent surgeries, trauma, or anything to the face or nose?
I have not, no.
Okay. So I'm going to go ahead and look up your nose and see if there's any obstructions.
Okay.
There is not. Can you occlude each nostril and breathe? Okay. Do you have a preference on which nostril you would like the NG tube to go up?
Can we do the right?
Yes. Okay. I'm going to go ahead and prepare all of my equipment. I have my NG tube. I have my piston. I have my lube, my sanitizer, my gloves. We have Jevity, 1.5 calories. That's up here. Jevity, 1.5, expiration date. And here's my kangaroo pump. Okay? I'm going to go ahead and sanitize my hands. I'm going to go ahead and put my gloves on, but raise your bed to 30 degrees. Okay? I'm going to measure the tubing. This is going to be from your nose to your ear, and then from your ear to your xiphoid. It's going to be about 55, so I'm going to put a piece of tape marking the 55. I'm going to go ahead and lubricate the end. And I'm going to have you tilt your head backwards. As I insert this into your nose, you're going to feel it hit the back of your throat. As soon as you feel that, you're going to want to gag. Don't. Just go ahead and look down and just start swallowing, swallowing, swallowing. This, as you're swallowing, I'm going to advance this down into your stomach, and that swallowing will help facilitate that, okay?
Okay.
Okay. So, perfect right there. If you want to tilt your head back, I'm going to insert this up your nose. It hits the back of your throat. If you want to look down, and you're going to swallow, 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 swallow. And it's going to be at the 55 mark. So if you want to hold that, I'm going to go ahead and tape this to your nose. And I'm going to go ahead and tape this to your shirt. And we're just going to hold that there for now. This is in your stomach. Okay. And I'm going to insert 30 mils of air, and I'm going to listen over the stomach, and this is going to make sure that I'm in the right position. I'm going to listen for like a bubbling sound. So 30 mils. And I'm listening with my stethoscope over the stomach. And insert, boom. And I did hear it, so it is in the correct place. Now at this point, I am gonna send you for imaging to make sure that to verify that it's in the right position. Okay, you went to imaging, you now came back. Good news, we're ready to go. It's all in the right places. I'm gonna act as if we're gonna continue a feeding that you've already had, so I'm gonna check for residual. So at this point, I'm gonna, like this, and I'm just gonna pull until there's no more coming out the tube. Okay, that was it. We have 200 mLs of residual. Since it is less than 400, I'm gonna go ahead and give it back to you. Okay. There we go. Now I'm gonna go ahead and set up the feedings. Okay, so this is the Jevity tubing, hook up the tubing. I'm going to bleed the line. I'm gonna unclamp, squeeze this. Okay, I'm gonna close the clamp. The tube is bled. I have the water up to the line. I'm going to feed this in the kangaroo device. So in through here, I'm gonna grab this, put it around the black wheel, pull this up through here, stick it in, continue to feed this, fold the clamp. Okay, so we'll act as if that is there. I'm going to hit the volume to be determined. I'm gonna make sure it's at 10 because I wanna make sure everything's okay, and I come back within the hour. I'm gonna put volume 10 milliliters an hour. I'm gonna hit the start and hold button. And now I'm going to label my Jevity. So I have Jevity 1.5. I put my name, I put the date, and I put the time that I'm starting the feeding. Properly label the Jevity. Okay. Now I'm going to connect the feedings. So it's connected. I'm gonna unclamp this. So I'm gonna unclamp it, but I'm gonna clamp it right back up so it doesn't go all over you. But this would be unclamped. I'm gonna go ahead and hit start. The wheel is gonna turn. I'm gonna make sure that I see it dripping in here, and we're good. So I'm gonna let that sit there. I'm gonna let that sit right here. You're getting your feedings. I'm gonna let that go for 4 hours. According to the MAR, it says for the first 4 hours, you're gonna get 10 mLs. For the next set of 4 hours, I'm gonna increase to 20 mLs. For the next set of 4 hours, I'll increase to 30, and then for the next set of 4 hours, I'm gonna go ahead and increase it to 40 for the goal of 40 milliliters per hour. Now I got the orders to discontinue the feeding. Okay, so I'm making sure, reviewing the provider's care plans and orders. I'm gonna make sure your name and date of birth. So,
Henry Jones. Birth date is September 23rd, 1972.
And do you have any allergies?
I do not.
Just making sure that I'm discontinuing the feeding with the right patient. Looking at my MAR. Okay, so at this point, I'm gonna go ahead and stop the feedings, clamp the tubing. I can discontinue this. I'm going to flush the tubing with 30 mLs. Give you the rest of your food. Whoop. Okay, and now turn the camera around. I'm gonna go ahead and remove this. I'm taking the tape off, I have a napkin under here, and I'm gonna slowly just coil this around my hand. Okay, and here's a napkin if you wanna tidy it up. I'm gonna dispose of all of this in the proper receptacles. Okay, I'm gonna lower the bed. I'm gonna raise your side rails. I'm gonna remove PPE and dispose of it. I'm going to sanitize my hands. Did you have any other questions?
I do not.
Okay, if you, here's your call light, and push that button if you need me, but I'll be back within the hour. But if you need me before then, you have that, and I'll be back as soon as possible. I'm going to make my exit. Would you like me to leave the door open or closed?
You can leave it open.
Okay.